Hi, I'm Randy Horton, and today I'm talking with my wife about couples therapy. She's a couples therapist. And so, Sarah, can you introduce yourself?
Hi there. Yes, I'm Sarah McConnell. I'm a couples therapist based in Derbyshire, where I have a private practice. Before the pandemic, I was working face to face, but these days I'm working 100% online.
And I guess before we do anything else, can you just say a little bit about what couples therapy is?
Yeah, really typically, this couples therapy is when a couple is experiencing some difficulties in their relationship and they seek out a couples therapist to help them figure out what's happening and to help them feel better about their relationship. That's really it in a nutshell.
Is this what some people call marriage advice?
Um, I think it's true that some people would call it that, yes. But these days, most couples therapists aren't sort of sitting there giving couples advice. They're really listening to them and helping them describe what's happening for them in the relationship and sort of helping them talk to each other rather than being the person that sort of sits there from above and gives advice. I think the name marriage advice, there was an organization in the UK some years ago called the Marriage Guidance Council. And I suspect, although I don't know, that back then it was much more about giving advice. But these days there are different forms of couples therapy that are not really about that.
Okay, and we've been using the phrase couples therapy. Some people may call it marriage therapy, but obviously you don't necessarily deal with people who are in a marriage. But what kinds of relationships does this work with? It's not even only romantic relationships, is it?
That's true. Predominantly, my kind of work is with people who are in a romantic relationship, whether they're married or not, whether they're gay or straight, transgender, bisexual, queer, doesn't matter. If they're in a relationship, couples therapy or marriage therapy is open for them. But there are other forms of relationship therapy for different kinds of relationships. So, for instance, in the kind of therapy that I do, which is called emotionally focused therapy, there is a form of that that works with families. And that can be, the whole family or different pairings or different, kinds of uh, I want to say pairings. I'm not finding the right word. Like it could be three or two or five or four. And we're still doing the same kinds of things. We're still working on difficulties in the relationships, but it's within a family. And then I haven't experienced this myself necessarily, but I've heard other therapists talk about the kinds of friendship relationships. Sometimes people come if they've having trouble or difficulties with a friend, and that's equally open for relationship therapy kind of work.
And when people do come to you for therapy, what are kind of the specific kinds of problems that might bring them to you?
Um, well, I talk about that in two different ways. Really, kind of in a very general way, and then in a more specific way. So, in the general sense, people are typically coming because they're finding that they're having repetitive kinds of conflicts that keep on coming up over and over again, and they don't really seem to be able to find ways to get to the bottom of them or solve them or feel better about them. Either that or they're having some kind of distance in their relationship where they're feeling like either they can't talk about something, it's hard to approach a topic, or they they just find themselves feeling really distant from one another. Or can be a combination of the two. Sometimes they have a conflict and then they don't talk for 5 days and then they find their way back to one another and then they have another conflict and then don't talk. So it can be a combination of the two. So those are the general things that people kind of find themselves coming for. But more specifically, very often people come because one part of the couple has had an affair, which can be really, really difficult for them to get over. So the couple will come and try to mend that. Really, in my work, we call that kind of thing an attachment injury. There can be other forms of attachment injury, especially when people have had times in their relationship where they felt let down by their partner, or they feel that their partner hasn't been there for them, and things seem to have changed as a result of that. So those kinds of things can happen. Um, so those are the main kind of things that people come to couples therapy for.
We joked about this earlier, but as I listen to you, I really think someone needs to get your card to Oasis.
Yeah, and I think when we were talking about it, you asked me whether you thought relationship therapy could help them, and I said I would go out on a limb and say that with the right kind of support, I think that emotionally focused therapy could help them. So please
I
give
think
it
they've definitely established a pattern of conflict and distance.
for sure. Yeah.
And so the other thing we talked about is whether this is considered a cure, because there are lots of articles and things about success rates for counseling that people read. And the first time I read them, I was very curious about what do they mean by success there? Does it mean just that the marriage lasted longer or something else? So what would you count as a success for the therapy?
Well, it's an interesting question. So um, in therapy does have research associated with it, and especially the kind of therapy that I do, emotionally focused therapy. There's a lot of research has gone into it where the researchers measure success really, in they look at what people felt like at the beginning of 12 or 15 sessions, and then they look at what they felt like at the end of that, and then they follow up 6 months later. So that's where the idea of success rates comes from. And in emotionally focused therapy, in the research that's been done, the success rate is around 70 to 75%. So that's pretty good and pretty high. But what does that actually mean in practice outside of research? When people come to therapy, basically they want to feel better about their relationship. They want to feel more connected. They want to feel that they're heard and listened to and taken care of. And so for me, that's the kind of success that I'm really more concerned about. How do you feel about your partner? How do you feel about the relationship? Does it feel better? Do you feel that you can rely on your partner? Do you feel your partner listens to you and really hears you and sees you? And those are the kinds of things that people typically report at the end of therapy when they've finished.
Oh, really, they're going to be the best judge, aren't they? If they feel happier, then that would be success, wouldn't it?
Absolutely, yeah. Yeah, and they have to sort of feel that together as a couple, if you like. And one, a big indicator of success is how they can talk about where they are. Oftentimes at the end of therapy, like the last part of therapy is looking back and saying, where are we now versus where we were when we came in, and what are we able to do now? How are we able to talk to each other now versus when we first came into therapy? So that's also kind of an indicator of success, that they're actually able to sort of look at themselves and kind of say, okay, we were here and now we're here.
So when people come into therapy and they're having all these problems and they're going to get to this stage where they feel better, how long would they expect to be working on those problems before they saw those improvements?
Um, that's a good question, and it's an interesting one. So for fairly sort of typical connections and disconnections and problems, and this is also from the research, around about 15 to 20 sessions is about average, right? So that means coming once a week or once every couple of weeks for about 15 to 20 sessions. But if there are more significant problems, so for instance, quite often an affair or multiple affairs, or if there's been some kind of trauma that people are challenged with, or if they've had some sort of trauma in their lives that have affected the way they sort of show up in relationships, that can take longer because it's more tender, and we have to go more slowly, and we have to really kind of help people express some of the things that they're feeling inside, which might be harder if they've had those kinds of things happen to them. And, sometimes that can mean that people are in therapy for a year or 2 years, if there've been a lot of those kinds of things happening. The answer really is it depends. As always, that's the kind of answer you always get if you ask a therapist, really. But that's a rule of thumb.
Yeah, can you go into just a little more detail about what kinds of trauma might affect the relationships in those ways?
Well, affairs are often characterized as being traumatic. So when you feel like that you have security with your partner and you know them and you can rely on them, and then you find out that all of a sudden that's turned on its head, that's a traumatic um, discovery. So that kind of thing can be classed as trauma. Um, Oftentimes, what we call in my world attachment injuries. Again, it's a similar kind of idea. When you feel you've been able to rely on your partner and you've felt very secure with your partner, and then somehow, either intentionally or unintentionally, they've let you down at a very significant time in your life, then that can feel traumatic, right? And so sometimes that really takes a while because people really sit in the pain of that and often express the pain of that in a kind of angry or critical way or a withdrawing way. So that can take longer to kind of really look at. But also, sometimes people have had really awful experiences in their childhood, in their past, that have been traumatic. So, child sexual abuse, or emotional neglect, or physical abuse, and inevitably, those kinds of traumas can find their way into a close romantic relationship. And sometimes people aren't necessarily always aware of how those traumas are kind of coming up when they get triggered, let's say in their romantic relationship. So sometimes we have to work really slowly with those as well.
So how does that happen? If someone's thinking of coming to you for therapy, what's going to happen in that session that's going to help them? Because it seems really scary to think, oh my goodness, the most traumatic thing I ever went through, I'm going to go in and have to deal with. So how does that happen in a way that's safe and comfortable for people?
Well, we may come to this later, but one of the most important things in the kind of therapy I do is helping to create safety in the therapy room, in the session. And what I mean by that is that a situation where people feel that they are heard and understood, and not only that, that they can be helped to tolerate difficult emotions, right? So often, if somebody's had one of those horrible traumatic experiences, their emotions are going to be sort of quite chaotic, right? So my job in the therapy session is to help them organize those. So I might work with them in a kind of experiential way where they might be starting to feel really, really upset and really angry. And I might say to them something like, can we slow down a second right now? Can we just find out what's going on right here, right now? Can you help me? What's happening in your body right now? And that makes sense to me. When you say, I feel this panic in my chest, when I saw my partner roll his eyes, it makes sense because it feels like that would be very painful, right? So that kind of tracking and validation um, hopefully helps people to feel a bit safer about the experience that they're having and feel a lot more understood. Basically, what I'm trying to help them do and what I'm trying to do is help them organize their experience so that it feels less chaotic and therefore a little bit safer to experience. So that's the kind of thing that we would do.
So this is kind of the same question again, but as you were talking about doing that, you were showing a lot of empathy to someone who's feeling something. And I
Mhm.
think a fear a lot of people have is that when you're empathizing with one partner, you're blaming the other partner. And I think it's particularly a fear, and you can tell me if I'm wrong about this, but more generally, not exclusively, but more generally, that men have, that they're going to come to therapy and be blamed for the problems. And
Mm,
indeed, you and I saw a discussion with a panel of male therapists who admitted that their sympathy tended to go to the female partner in a heterosexual couple. If she looked hurt,
mm.
their heart would go out to her. So how do you avoid someone feeling blamed or judged in the session?
That is a really good question, and it speaks very much to the kind of therapy that I do, the emotionally focused therapy, because one of the things that we understand in EFT, like the place that we come from, is understanding that that couples, when they're having this conflict or distance, have what we call a repetitive negative cycle, or a negative dance that they do with each other. And what that means is that each person has a part to play, a role to play in that dance, whether intentionally or unintentionally. And so, what we're going to do is to really try and understand that negative pattern or that negative cycle or dance, to slow it down, to help people understand, yes, they really might be hurt and they might be crying and they might be angry, or they might be sort of expressing their hurt in lots of different ways. But we're going to try and slow it down and understand that the likelihood is that something their partner did or said triggered them into that distress place. And then they have a way of coping with that distress, which can then trigger their partner into their partner's distress. And the partner might then cope with that in a number of different ways. And so we slow that down. We help them understand that that cycle is the enemy, is the thing that we're trying to fight here, not each other. And we also help them understand that their ways of coping make sense, in the sense of either their history and their background, or what's happened in their relationship. The ways that they cope are often just protections that they have had to do because they've had no other way of dealing with that pain or that distress. So I don't know, I've waffled on a bit, but I hope that sort of answers the question. Really, we see the cycle, not really the blaming the individuals at all, whether male or female.
Yeah, I think you've explained pretty well how it works in practice. So now, the important question for someone like me, what is the theory? How does the theory work behind this? Can you talk a little bit about the theory behind this practice?
Yeah, sure. You and I were talking about this before, and I sort of said this in a slightly different way then, but I'm going to start this time with um, the first theory, which is systems theory. So this comes from folks like many folks looked at systemic theory. Um, People like Jay Haley or Salvador Minuchin in the US, Chloe Madana's, people like that in the 60s, 70s, and 80s, they were operating. And what they looked at was how a couple or a family, or really any sort of group of people, is a system. And what happens in one part of the system affects the other part of the system. Just like if your central heating breaks down, you have, one part of the pipe is leaking, and that affects another part of the system where you don't get water out of the tap. So if a couple's a system, then what happens with one partner obviously affects the other partner. And so that's the first kind of theory that is contained within EFT. And I was talking before about the negative cycle. That's really kind of from systems theory, right? That's kind of how we start to understand how people interact with one another. The second piece theory is attachment theory, and this comes predominantly from John Bowlby, who is a British psychoanalyst in the 50s and 60s. I think he died in 1980. But what Bowlby said was that we learn about security and insecurity from our earliest relationships, and if we feel heard and listened to and attuned to by our caregivers, we learn to sort of feel secure inside. But if any of that is missing, or we're neglected or abused in some way, more often than not, we don't feel secure within relationships. And so what happens is we kind of learn about security and insecurity through all of the relationships we've ever had in our lives, so that when we come to meet our romantic partner, we bring all of that with us. And, you know, partners can inadvertently trigger insecurity in each other, which then results in that negative cycle. So that's the attachment piece. And then finally, there's the experiential piece, which is more about how we do therapy in the room. And what I mean by that is we can talk a lot, sort of, from here, from our brains about what's happening. But it's only when we start to dive into an experience that somebody is having that we start to sort of put everything on the table, as it were. And what that means is that in the therapy room, I might be asking somebody, they might see their partner roll their eyes, and I might say to them, so what happened just then? It seems like something happened for you. Can you help me? What did that feel like inside, right here, right now? What's going on in there? What are you thinking? What kind of meaning are you making of that? Trying to really understand their experience in the moment and slow it right down, because experiences tend to happen really fast. It's only when we slow it down that we can start to understand and organize them, and then speak to each other in the therapy room about it. So those are the three theories.
Very good. Well, thank you. I don't have any more questions. Did you have anything else to add?
No, I don't. Not really, except to say that oftentimes it is a scary experience to even contemplate couples therapy, but my sense is that most people do find that once they start the work and they understand it, then they can feel a bit more secure in it, even though it might be difficult. So I just encourage people to take the first step, really.
Very good. Thanks, Sarah.
Okay, thank you.
Bye.
Bye bye.